Hello, everyone, and welcome to the podcast with Magdala Caston. I am super excited to have you here and excited to share my insight on this topic with you. But before we dive in, I want to show you a practice and what thoughts come to mind immediately when you see this practice. I also want to show you a second practice and also what thoughts come to mind when you see this one. So, hi, Chadley.
Hello.
I would like to know what brings you in today.
Well, the reason I'm here speaking to you today is because I just I just keep feeling like I'm not enough, you know? And it's like no matter what I do,
Mhm.
it's just like I keep going back to the same place.
Mm,
And I'm just feeling damaged and everything I do is just not worthy.
I see. What you just saw here are two practices, one that depicts traditional Chinese medicine that treats or improves mental health, and the second one is a modern practice in psychotherapy, recognized as cognitive behavioral therapy. Let's talk about it. In the recent years, you've probably noticed, I have at least noticed a lot of conversation or a cultural shift around mental health conversation. What was considered as a sign of weakness when it comes to mental health disorders, where suffering silently was literally more common, has now received a shift where we see even public figures, celebrities, they're actually using the platform to talk about it. It's unveiling more and more of the stigma or negative stereotype, to bring awareness on the impact that untreated mental illness or lack of therapy might carry. That's big. On the podcast today, we will discuss about the modern day form of therapy and treatments, and then we're gonna compare that to traditional approaches. So exactly what we saw at the very beginning, one traditional approach to therapy, and the second one was a modern approach to therapy. Okay, so let's start from the very beginning. How men dealt with mental health and psychological disorders. There has been what we call traditional approaches to mental health. Traditional therapeutic approaches operate from a holistic standpoint, viewing physical health and mental state, environmental condition, cultural identity as deeply interlinked dimension of the human experience. While the modern and traditional both put the patient at the heart of care, traditional therapies tend to focus more into the body's own wisdom, its felt sensations, and the ever shifting relationship between the person and the world that they live in. We have what we call traditional Chinese medicine, dating over 2,000 years of ancestry, which offers different type of therapies such as acupuncture, herbal medicine, tai chi, qigong, etc. Throughout these therapies, traditional Chinese medicine believe health goes beyond illness and aim for a dynamic equilibrium between the body, mind, and soul. Acupuncture, I'm sure you've seen acupuncture before, which is like having small needles inserted in your body in specific areas of the body to help fight disorders like anxiety. Herbal medicines are plant based ingredients with properties or mineral substances, and Tai Chi or Qigong are specific exercises method, which is the first video that you just saw. So there is a second traditional medicine practice also that people use, which is the traditional indigenous healing practices, also used as therapeutic modalities, including the medicinal use of plant-based remedies, spiritually grounded healing rituals such as sweat lodges, drumming, smudging, and storytelling. Did you know that Concordia University offers smudging ceremonies as a way to ground oneself, cleanse the body, mind, and spirit to promote mental health? Good to know, eh? So, beyond the traditional therapies, we also have the modern therapy, and which is something that we're gonna do today, as I mentioned before, comparing, the traditional and the modern day therapies. So modern day therapies offer a different approach when it comes to psychological disorders. It is rooted with a psychological assessment through talk to understand the mind of the patient. Within the practice of psychotherapy, theory acts as a roadmap to guide the representation of reality, tell the therapist what to know, what questions to ask, the timing of intervention, the evaluation of the progress, and whether or not it's working. Psychotherapy literally brings new insight and different possibilities for healing. Let's talk about the origins of psychotherapy. The origins of psychotherapy start with Dr. Sigmund Freud in 1909, a neurologist who was fascinated by the structure of the mind and its defense mechanism, especially when it comes to facing suffering, human suffering. During this period, there were other movements. So he was not the only movement that was actually discussing about mental health. There was other movement which emerged, like the Emmanuel movement, pushing forward the conversation with talk therapies and critical analysis of psychiatry and also psychotherapy. There are a lot of different type of psychotherapies. Let's talk about the most common ones, such as the behavior therapy, which invite patients to look at their past, emotions, and experience that they have never talked about, but continue to have an impact on their lives. Throughout behavioral therapy, patients are reshaping the habit that are enabling them to have or to live their best life. The second one is cognitive therapy. It takes a different approach as well because it focuses on cognition and emotion. There is a unit in the class that talks about emotion, and we're fully aware of the impact that both primary and secondary emotion that go through different brain pathways and how it affects cognition, then behavior. Through cognitive therapy, the patient is being guided to restructure the use of both pathways in the brain. The fast pathway that operates through the thalamus and amygdala that interpret information automatically, and the slow pathway that goes through the frontal lobe of the cortex take more time to process information. Cognitive therapy allows the patient to become more conscious on how they are interpreting their experiences and avoid misconception. The interrelationship between emotional and cognitive processes is vital because it influences the behavioral responses. In comparison to traditional Chinese medicine, emotions are seen as more of a form of QI, which is the vital life force flowing to the body. And it's interconnected to specific organ system. For example, they will say that this emotion is related to the heart, this emotion is related to the liver, etc. and etc. So emotions are literally distributed in our whole body with real consequences in our body organs and tissues. Hence why TCM, traditional Chinese medicine, is focused on more of a holistic approach for treatment. So it sees the whole body, not just the brain pathways that we are seeing in cognitive therapy. It sees really the whole body and the way that we process the emotions and the direct relationship it has to different parts of our bodies. Here comes the cognitive behavioral therapy, with the purpose to modify cognitive dysfunction and negative behavior that comes with it. An important technique in cognitive behavioral therapy is the ABC model, which stands for activating events or existence of the situation. B is for belief or the assumption. And C is for the consequences or the consequences of such belief. This technique deepens therapists' understanding of the patient's actions and behavior because of the correlation that its cognition process has to its behavioral one. So because of the complexity of the cases, it is sometimes necessary to combine CBT, which is cognitive behavioral therapy, with other therapies. A guide on CBT with children, which is a book which is written by Katerina Manassius, illustrates that sometimes to yield better results, a combination with, for example, play therapy, psychodynamic, or family therapy can reduce the stigma, the burden on children, while keeping the benefits of the involved therapies. It even goes further to include that psychotropic medication to control anxiety and improve ability to learn CBT strategies. So what they were saying in the book is that they feel like they were saying that one type of therapy when dealing with cognitive behavioral therapy in children sometimes is not enough. They have to come in, they have to bring other type of therapies that allows them to make a better analysis and deal with the psychological disorder. Another therapy that we're going to talk about is humanistic therapy. I actually have a book here on the problem with the humanistic therapies. And what we see is that when you talk about humanistic therapy, it was developed by Carl Rogers to the person centered therapy. The humanistic therapy focuses on growth that inspires the patient to have a positive view on the human nature, and it also helps to empower the patient on responsibility. Rogers also presented the type of therapy is more effective because it fosters a positive relationship with the patient through what we call the therapeutic alliance. We have other forms of therapy. We have play therapy, we have drama therapy. So it exists different forms of therapy. And no matter what type of therapy that has been introduced to the patient, depending on their psychological disorders, the positive impact that is present in therapies is known. We see a lot of sources are stating that they see the impact of these therapies. Based on the research, I want to present 3 reasons why psychotherapy is effective. The first one is the human need to make sense of things. As if humans are, uncomfortable with because humans are uncomfortable with suffering, and throughout therapy, they are able to unlock the reason why, and it also helps them to make sense of things. Let's say, for example, somebody who had a very difficult childhood that carries through their adulthood. As they become an adult, they want to make sense of what happened, what transpired, and why they feel this way. The second reason is that the human need for trusted social relationship. We see that through therapy, psychotherapy, a patient develops a trusted relationship also. And for them to actually have trusted social relationship in life, they need to go to therapy. The third reason is the human use of language to reshape understanding. We know that psychotherapy is through talk. You get to sit down and you talk to somebody to actually verbalize what you're feeling. So as we talk to a professional, a therapist, you put into words on the different situation that you've gone through to help you reshape your understanding. So it pushes people that are in therapy, it helps them to yield more results when it comes to how do they recognize the patterns of the psychological disorders and finding the right treatments for that as well. And let me mention that at the core of all those different type of therapies with psychotherapy, we do have the therapist or the professional that is a medium to bring us closer to uncovering or discovering psychological disorders that we might have. A study of 50 teenagers in London exposed that humanistic therapy throughout a school-based humanistic counseling program presents the following findings. It says that relationships were improved, they were less distressed, the school was improved, and they had the coping mechanism was improved as well. The most helpful characteristic is that they felt like they were in a room with non-judgmental people in a non-judgmental environment, which created for them a very reliable space for them to be able to talk openly. Because the nervous system plays a key role in psychological disorders, we need to balance neurotransmitters in the brain. So it has become very necessary. Therefore, a biological approach to treatment is revealed important throughout biomedical therapies. Several medication is used like antipsychotics, antidepressant, mood stabilizers, etc. are used to treat psychological disorders. A study using a method called individual participant data meta-analysis proved that adding antidepressant medication with short-term psychodynamic psychotherapy STPP to a group of severe depressed participants helped them not only to decrease depression but also to sustain longer after the treatment. So what we see here is that therapies play an important role in our society because human beings are going through different challenges. They're going to different situations. They're going to different stages in life. As they were smaller, they get older, life is ever changing for them. And life is also inflicting suffering in them. Therefore, having the right kind of treatment is detrimental to find the necessary result for any type of psychological disorders. I think mental health will always be an important topic, and awareness is always necessary. As I mentioned before, people are now talking about mental health. We are no longer ashamed to talk about mental health. We're no longer ashamed to talk about mental health in different platforms and seeking the right help because we know that the consequences can be very hard for mental health. So it reminds me of a very important cause that I see often every year, which is Bell. I think they call it Bell Let's Talk. So thank you for listening. Thank you for following it along. I really hope that we're able to see today the impact that modern therapies have in our lives and how necessary it is to continue to bring awareness. See you next time. Bye-bye.